Two congressmen joining us to discuss the possible fallout of a decision. We have Republican Michael Burgess of Texas, he's a medical doctor, and Democrat Peter Welch of Vermont. Gentlemen, good to see you. I'm both going to ask you a similar question, but kind of the opposite, and you'll understand when I do it. So, Representative Burgess, if we get this, and you're here in studio, so I'm going to start with you. If they do not overturn health care reform, what's the first move for Republicans? And then for you, Representative Welch, I'm going to ask you to overturn the mandate. What's the first step? But Representative Burgess.
Well, bear in mind this thing has never enjoyed popularity with the American people. And I think you will see, the Speaker has said, if it doesn't happen, then we will once again renew the efforts towards the repeal of this legislation. Look, this was a bad product start to finish. The rough draft got signed into law. That is the real problem here. Mm-hmm. The Senate put something out on New Year's Eve, or I'm sorry, Christmas Eve to get out of town before a snowstorm. It wasn't the finished product, but then they lost Massachusetts. They didn't have a 60th vote. And Peter and I were together in early January of 2010, and I think the consensus was then that, yeah, we were going to come to a conference and get this thing was going to get worked out, but it never happened. And as a consequence, it's very bad. It was essentially let's make a deal over in the Senate, and it got signed into law.
Representative Welch, if the Supreme Court, and let's focus right on the individual mandate, right, because that's the thing that holds this it's the financial linchpin here. If they overturn that, what's the first move by the Democratic Party here?
Well, really there is no plan B, because if it's overturned, then we're back to the insurance-driven system, which has really been a very, very significant factor in having the cost be very, very high. I mean, one of the biggest challenges we have in healthcare is not only that access is denied to 45, 50 million people, but the cost is increasing much faster than the rate of inflation. And one of the big goals of healthcare is to arrest that rate of growth of cost and make it more affordable.
Go ahead, I hear you. There was a groan that came out of you.
Painful to hear my good friend Peter talk in terms of talking points and sound bites, because that is just not true. I mean, look, the one thing we were asked to do in the summer of 2009 as members of Congress by our constituents was, don't do it, first off, but if you're going to do it, don't mess up the system as it works today, but if you're going to do anything at all, help us with costs. And what has happened? We have messed the entire system top to bottom. Regardless of what happens on today or Thursday, there is going to be a lot of digging out that has to be done. But what's happened to cost, Peter? It's gone through the roof. And if just the individual mandate is struck down, all of your other stuff stays in there, your medical loss ratio, all of the market inhibiting activities that the Senate put in there is still going to stay.
Well, the goal of Michael and the others is very clear. They wanted to repeal the whole thing, and that means some of the very good insurance reforms, like our kids staying on our policy till age 26, not being thrown off insurance because you get sick, not being denied insurance because of a pre-existing conditions. All of those are gone as well. Also, on this individual mandate, it's much like Social Security in a way. Social Security, everybody is mandated to pay into the Social Security fund for mandatory retirement. Everybody is covered. Everybody pays. That's right. And in health insurance, if everyone's going to have access to health care, my view is that all of us have to help pay for it. So the mandate
but
there
if
is
you don't work, you don't pay into
basically
Social Security. But if you don't work, you are going to be required to have health insurance, right? I mean, there is a fundamental difference
But you
there.
get subsidies.
Yeah, but the mandate is a very different thing.
The mandate, it is different technically, but it's not different operationally. In other words, in Social Security, whether you want to have a retirement system or not, you have to pay into it.
Does it bother
you? If you have no wages, you don't pay into it.
The original mission, when the White House proposed this, their mission was to reduce the amount of money spent by the government on health care for Americans. And when you read the CBO report, they were very clear about bending the cost curve and controlling costs. And when you read the original CBO report, they make it very clear that government spending on health care under health care reform goes up.
Yeah, and I would just offer, we don't know the whole story.
You have 45 million more people that are going to be covered. And what we have right now...
You just admit that it does not lower the cost, though, of government spending on health care reform, right? On health care. I mean, it goes up. You admit that.
It's the net cost to the country. I mean, the problem we have now, among other things, is that if you have an insurance policy that you pay for, about $1,100 a year premium is to pay for folks who show up at the emergency room and have no health care coverage but get coverage. You know, in Vermont, if you get sick, you're going to get covered. You show up at the hospital, they're going to take you in, whether you have insurance or you don't. But there is going to be a cost, and that cost gets shifted onto folks like Michael or me or you. Anyone who has a health insurance policy, that's about $1,100.
But Congressman, the overall cost is going to go up. It's not going to go down as a result, correct?
The overall cost will go up if you're going to add $45 million. Right. What you've got to do is get the cost per person down. Healthcare is incredibly expensive, and I don't care whether you pay for it with an individual mandate or the government pays for it or an employer pays for it or insurance pays for it. If the cost is going up 2 or 3 times the rate of inflation, as it has in some years, then that is going to be very, very tough on the economy. You know, we're pushing towards 18% of the GDP to cover health care, and that's not sustainable for our employers.
Yeah, but there were plenty of other things that could have been done other than this. And let me just say about that issue of the uninsured driving up the cost for the rest of us. Yeah, they do, but it's a little bit. What really drives the cost up is the cross-subsidization of Medicare and Medicaid, which never pay their full freight, so hospitals and doctors are left with having to come...
How does that work? If I go to the hospital, I pay, with my insurance pays $1.25 of my $1 of cost, because Medicare patient is only paying something like 85 cents of their $1 of cost.
65 or 70 cents.
Okay, so
and that
but
is
directionally I'm right on those numbers.
Correct, and that is the real problem. Now, and really what bothered me at the Supreme Court when I went to the oral arguments on the individual mandate was they said the uninsured are driving the cost up. No, they are, but it's just at the margins. What's really driving the cost up is the government interference in health care and the fact that they don't pay for what they have promised and subsequently what the real...
The actual cost.
Well,
no,
see,
they're not paying for the cost.
Michael and I...
The costs are too high to begin with, correct?
Well, when you talk about high costs, look at 2014 when the subsidies kick in the exchanges and people who earn $85,000 a year are going to have their insurance subsidized by the federal government if their employer drops them, and I promise you they will. This cost goes through the roof. No one has any idea. They talk about $1 or $2 trillion over the 10-year budget window. This thing could cost $3, $4, or $5 trillion over that same budgetary window, and we can't afford what we've got.
Let's bring in
Representative Welch,
if I can get a word in. Well, if you have a fee-for-service system where it encourages volume, that is going to promote volume, and then that's the major factor why we have such high health care costs. The incentive in the system is to do more services, even though that doesn't result in better health care outcomes. So whatever system you want, moving towards accountable care organizations, moving towards pay for performance rather than fee for service, these are the things that have to be at the heart of bringing the cost down and the quality up.
Why not shift a small part to the individual? Wouldn't that shift incentives a lot if people had to really think just a little bit harder about whether or not they were going to do something or where they were going to get the service provided?
Absolutely, it would.
That would be part of it. Sure. Yeah, I think that's part of it. I do.
All right, we can agree on something. Gentlemen, it was great to have you here. Representative Burgess, thanks for coming in.
Great.
We really appreciate it.
Thanks,
Representative
anytime.
Welch, thanks so much. All right.